This session is a part of a series based on the release of the Access for All report on young children and caregivers. And today we are discussing the topic of 15-minute neighborhoods as a key concept embodying access in cities. The presenters will talk about approaches, best practices, and tools to measure access. We will first hear from Aimee Gauthier, the Chief Knowledge Officer of ITDP, who will share with us background on the Access for All series. Next, we will hear from Ankita Chachara, the Director of Knowledge for Policy at the Bernard Van Leer Foundation, who is today's moderator. She will also introduce our panelists. Let's welcome Aimee Gauthier.
Hi, everyone. Good morning, good afternoon, good evening. I'm really excited to see the faces that I see, some of them, and also to see all of you all in attendance. This is a really interesting conversation, and I'm really excited that we're going to kick it off, and I'll start right now. I think I wanted to begin with just a brief look at what is access before we dive into the topic of babies, toddlers, and caregivers. And ITDP has been working on sustainable and equitable transportation and urban development for over 35 years. And for us, access is essentially about connecting people to their lives, essentially through the integration of mobility and land use, which is how do I get to the places that I need to go? So you can see how do I get is walk, cycle, and transit, and where do I need to go is a mix of services, open space, dense connected neighborhoods. But the question we really needed to be asking is access for whom? And traditional transportation planning centers the non-disabled male commuter in cars and motorcycles. And that's leaving our streets more polluted, less safe, more congested. You can see in this picture, a woman is walking in the street because the sidewalks are a mess. The streets are clogged with cars. It's also leaving our cities more sprawling with longer distances and longer travel times and more duress to get around the actual city. So we partnered with the Bernard Van Leer Foundation to really dive deep on access for babies, toddlers, and their caregivers. We came together, collaborated to produce this report that you see on the left. And it really looks at like, what are the unique mobility characteristics of caregivers and babies and toddlers? Some of them you can see to the right of the screen. But it also looks at access to what? Like, what are the unique needs that caregivers and babies and toddlers need? That can be anything from basic services. We'll go into it in more depth later. Basic services, open spaces, healthy, safe environments, a good quality public realm, low stress environments so that caregivers can give the attention and interaction to their babies and toddlers. So really trying to unpack where do they need to go? And then how are they actually getting there? And what we found is that walking, cycling, and public transport were the main modes that caregivers around the world were using. But these modes also confer more benefits to the interactions between babies, toddlers, and their caregivers, between their environment. It gives them physical activity, social connection, and it's cleaner. So after doing this analysis, we came to two main frameworks for thinking about how to improve access for babies, toddlers, and caregivers. The first one is the 15-minute neighborhood, which we're going to delve into with some more depth today. And then the second one is 10-minute public transport, which we're going to look at in a couple of weeks. I do want to just say it's been really lovely to collaborate with the Bernard Van Leer Foundation. I think the issue of early childhood development is something that isn't really well known or understood, but the more that we invest in those early years and the way that we can do it through mobility and land use, through access, can make a huge difference on human development and quality of life. So with that, I will happily pass it over to Ankita, who has been our main partner in this exploration, to kick off this really interesting discussion.
Thank you, Aimee, and thanks for setting up the stage for early childhood development and how it intersects with urban planning and mobility itself. So I have a few slides that I wanted to kind of quickly bring to the conversation. And I think as you know, at the foundation, we started to explore this intersection of the built environment to early childhood development, one of the questions that we've been asking our partners and of course, whoever we meet in the field of urban planning is that if you could experience the city from 95 centimeters, the height of a healthy 3-year-old, what would you change? And it's not just shifting the perspective into the actual height, but also thinking of all the aspects from the policy to the way you move in a city, to the way you access services from that perspective with a caregiver. And you mentioned that early childhood necessarily hasn't been explored as much in this field. And I think the biggest thing for me coming from an urban background into this was, the knowledge that we have now about the fact that the first 5 years of a child's life is a big window of opportunity. In fact, 85% of the brain that we have today, the neural connections in there were formed when we were in those early years. So there's huge science on the impact that you have and the consequences that you can have from that age to what you become as adults. And this translates into, of course, health and income benefits, but also recognizing that even today, the scale of this problem is huge. And there are about 250 million children that don't have access to what they need to get to their full potential. And if you look at the money invested, the return on investment is really high. Like for every $1 spent, you can get about 6 to 17 USD back. And kind of basing it on the scale of the problem and recognizing that, we can't just talk about early childhood development in silos. The fact that, babies, toddlers, and caregivers live in cities, a lot of them do, and the fact that, they experience their cities differently. And I think that's what's really amazing with the paper of Access for All, which is really talking about what's that experience. From our studies, we know that, the 3 things that we've been really kind of surprised to see or have been really kind of engaged with is the fact that, from air pollution perspective, babies do absorb 4 times more air pollution. So that exposure that they have actually starts in the womb. The fact that toddlers and caregivers move more slowly compared to able-bodied adult. And I think that's the core of some of the work that you've done in this paper, and also kind of touching on the way they move around the city. And then finally, on the services, access to nature is really important for them. And if you look at how our streets and mobility has been designed, often green infrastructure is forgotten or is the last piece of it. So how do you start to incorporate that in the way we think about mobility and think about mobility holistically? So really, when you think about children and caregivers in this space, it is about thinking of it holistically, not just from like one perspective or one lens. And I will say that for us, as I mentioned, clean air, nature, and proximity to services and healthy spaces is one of the 3 key factors that start to tackle or start to address the needs of children and caregivers in urban environments. And the way we've been working with cities is through 3 entry points, which is public space, mobility, and neighborhood planning. And I think that's where the Access for All, specifically the discussion that we're going to have today on 15-minute neighborhoods intersects, because you're talking about public space within those 15 minutes as a service. You're talking about the neighborhood planning itself of how people connect to spaces. And of course, you're talking about at the core of it, mobility, how people move within those 15 minutes. So I'm really excited to be moderating this session and inviting some really amazing speakers today. So I'm going to quickly introduce our panel. We've got Ivona Alfred, who's been really core in developing some of this guidance, and we've been working for a while. So Ivona, it's really amazing to have you here. Ivona is a program manager at ITTP. She's, of course, one of the key contributors to the paper and the Access for All report. And she will talk about 15-minute neighborhoods and give us some more insight and the details from what I just shared. We have Anuela Ristani, the Deputy Mayor of the city of Tirana. And if you already haven't heard about what Tirana has been doing, I think this is a great opportunity. The city's really been a lighthouse for initiatives around early childhood development, but also creating more child-friendly conditions in the city, including upgrading the pedestrian infrastructure, bike lanes, greening the streets, you name it. They're really leading the team here. So really excited, Anuela, that you could join us. We also have Mangesh Dige he's from Pune. Of course, his commitment is really high. I know he's stuck in traffic because of a festival in India, but he's joining us in transportation, and truly, really, he'll probably share the insights from the street itself today, I guess. And he's a city environment officer in Pune. He's representing the Urban 95 initiative in the city. He will talk about pilot projects, interventions like retrofitting of streets, sustainable modes of transportation, and also how the city is looking at improving air quality through the lens of mobility, which I think is really interesting. And then finally, we have Santiago Fernandez Reyes. He's an urban development and research manager at ITDP Mexico, and he will talk a little bit about what are the tools and ways that tools that can help us measure access and how cities can use them. So with that amazing panel lined up, I'm going to stop talking and pass the floor to Ivona, and also invite all of you to please put in your questions. We'll go one by one and then have some time for questions in the end. So Ivona will pass it on to Anuela, and then Anuela to Mangesh, and then Santiago, and then we'll jump into a quick question answer round. So I'll stop sharing my screen, and Ivona, all yours.
Great, thank you so much. Let me just share my screen. I hope it's visible right now to everyone. Okay, so great. Thanks, Ankita. I'm very happy to present the synthesis of the report focusing on 15-minute neighborhoods. So as we heard from MA, she described what access means and why it is important for cities, especially for different users in cities, such as the babies, toddlers, and their caregivers. So we know that access is actually an enabler of the core functions of cities that cities need to fulfill. That includes provision of quality life standards, security, productivity of the city, enabling safety, running basic infrastructure, and so on. And from Ankita, we heard that why thinking about urban environments is important from the perspective of childhood development and how the early years actually play a fundamental role in adult life. So with that, I wanted to talk about the 15-minute neighborhoods concept, which is one of the 2 core recommendations in the Access for All report. So let's start with reiterating the fact that sustainable mobility is the most preferred form of transportation, especially for women and caregivers at large. And in many places in the world, walking is a matter of choice. You know, we have places where de facto there are amazing places to walk because the conditions support it. But in some other places, walking is the only option. Yet in other places, we see a variety of forms of transportation that help overcome the issues of safety or issues of distance, where trips are better off done with frequent transport. So while walking is the most ideal mode of transportation, walking and cycling for short and convenient trips for caregivers, we need to understand the different constraints that they have associated with walking, which include shorter trips due to physical constraints, traveling with their babies and toddlers, and often with goods. This, of course, means slower walking speeds, trip chaining, which means reaching multiple destinations in one trip, limited time because of caregiving duties, off-peak travel, which often limits the transportation options, and finally, the care-specific destinations, which are crucial in everyday caregiving routines. So in a bar graph, you see the distance done at the speed of a caregiver walking with a toddler is completely different from the distance of a person not burdened by caregiving duties. So that person can walk faster and reach as much as 4 times further. So mobility constraints and characteristics and distances that caregivers can comfortably walk is one angle that we need to consider when we define 15-minute neighborhoods. So the second aspect of this framework is the destinations piece enabled by land use planning. And the paper really analyzes well the relationship between the needs of care and proximity to home. Based on mobility behaviors I just shared earlier and the frequency of need, the main takeaway here is that key destinations that support the caregiving needs and needs of babies need to be as close to home as possible, especially those that are needed on daily basis or sometimes even few times a day. And they have to be accessible, preferably on foot, within the slowest walking speed. These places include playgrounds and green spaces where playful and loving interactions can take place, grocery stores and other places with fresh produce, daycares and preschools, and local health services. So here you can see that 15-minute neighborhoods can look in many ways around the world. So because basically the conditions may vary, such as urban fabric, different community attributes, and so on. And not all neighborhoods are one size fits all, we have to remember that. But what they all have in common is the ability to reach daily needs within 15 minutes through available sustainable modes of transportation. And they offer places with healthy conditions to thrive. So from the technical standpoint, 15-minute neighborhood is a unit of access. And in this case, for the slowest moving users with different mobility constraints. And many cities in the world actually have been using sophisticated ways to measure it to see gaps in land use planning. However, the perspective of childhood development and caregiving needs shows us that access should be also grounded in healthy, safe, and playful environments supported by multiple mobility options. So here are the key elements that create 15-minute neighborhoods healthy to thrive. We have the basic infrastructure, local mobility, destinations, environment, and play. So the basic infrastructure, local mobility systems, and destinations are the foundation enabling access, but we really have to look at the role that cities have because the cities are not only about hard infrastructure like buildings, streets, and infrastructure. We have to really look at their role holistically. So for babies and toddlers, as well as everyone else in the city, a healthy and safe public realm, play areas, and multiple travel options that are convenient are important or as important. This includes 10-minute public transport that connects to the rest of the city beyond the neighborhood. So at the basis, streets should be planned as connected, sustainable mobility networks that can carry high quality public transport service. There should be street drainage, sewage, and running water. So this is important to laying out a foundation for new development because it is much harder and more costly to retrofit places with disconnected and insufficient streets later on. And really, we really have to talk about these elements if we want to scale up this messaging around 15-minute neighborhoods to different contexts where really developing basic infrastructure does not go hand in hand with urban growth. So again, in the framework for access through mobility, we emphasize that different travel options must be available to support 15-minute access. This is really essential to help caregivers plan integrated and flexible trips and rely on modes that best support their safety and mobility constraints in the given context. Main considerations for local mobility include having multiple travel options, safe conditions for walking and cycling, such as wide and smooth sidewalks for maneuvering strollers or walking aids, wide and protected cycle lanes, as well as active frontage with no obstructions like compound walls, and street furniture that encourages walkability. In the framework for access through land use, again, we emphasize proximity to a mix of different services through different mode options that caregivers can use, even beyond the immediate surroundings. So this is just reiteration to what I mentioned earlier. And local destinations are about land use planning so that residential uses are matched and planned together with the activities. The priority services like daycares, playgrounds, grocery stores must be located as close to home as possible. and child-oriented services can be clustered to reduce necessity to trip chain. We also have informal vending and pop-ups that support local destinations. And very importantly, housing types or housing typologies, including affordable housing, are part of land use planning. And it is important to point out that inclusive housing policies support families of different income ranges. For local play, since young children learn through play, having diverse and frequent open spaces, greenery, and play streets is instrumental to healthy cognitive and physical growth. These elements are relatively easy and cheap to install, but they have tremendous impact on the health and well-being of caregivers with their babies and toddlers. Local environment, having a healthy environment where children's growth is not aggravated by air and noise pollution is beneficial to everyone. Interventions improving street conditions and reducing car space, including tactical urbanism, traffic calming measures, or soft infrastructure like greenery, are again cost-effective and require least coordination efforts to compared to long-term changes, but they create immense benefits for babies and toddlers. And finally, cities need to include the perspectives of gender and the caregivers, babies and toddlers, in their policies in order to create these environments to thrive. The policies need to be grounded in qualitative and quantitative data for care trips and travel patterns. And cities really need to focus on public awareness and participation programs that give community input and buy-in. And to do that, they can include low cost and high impact pilots to produce quick wins and build community consensus. So this is just a summary of achieving 15-minute neighborhoods. And I expect that we definitely can discuss more with the audience, and the panels will also present solutions and interventions in their cities. So with that, thank you so much. And I will invite Anuela to present. Can you hear us, Anuela?
I'm unmuted, yes. The expression of the last 2 years. Hi, everybody. It's such a pleasure to be here. And it's so great we're talking what we'll be talking about globally today and how to keep them alive as they're doing in Ukraine. I don't know for you, but for me, it has been pretty impeding to continue with my everyday stuff, knowing that, you know, stuff like that is going on. So I just wanted to take a minute to remind ourselves how important our kids are, but then how important it is for us to be human in the all meanings of the sense. And what I mean by that is that giving children and toddlers and giving people the opportunity to fully access their city is to basically respect human rights. And it's so fundamental that we miss to understand that what we're talking about here is not transportation as a science, is not a civic duty, is not, you know, some first-class problems. This is basic human rights. And what are basic human rights are the opportunity or the means to be able to benefit from all public services independently from your origin, income, race, gender, positioning, and whatsoever. And we have failed as cities to offer that to our citizens because we've given priority to the ones that had more means. We've given more services to the ones that were living in prime real estate places. And we have failed to understand that the same need is for everybody. So if you're able to you know, spoil your kids with a lot more fancier houses and schools, that should be up to you, but that's not the job of public service. That's not the job of the city. The job of the city is to invest in basic infrastructure for all, to be able to provide same services and access to services to all. So a hospital cannot be closer to a certain neighborhood and then be further to another neighborhood just because of concentrated wealth, just because of income or zip code. And basically, the 15-minute city is this, is exactly this. It's nothing more scientific, complicated, extroverted. It's providing the same human rights to every citizen despite it all. And that's the core of our job. And so I could be talking about what we've been doing in Tirana, which is, from providing bike lanes and teaching kids as early as 3 years old in all of our public kindergartens and nurseries to be able to bike. And then once they learn how to bike, they can actually go on the street and test those bike lanes. And that's twofold important, not just because it teaches kids about independence and the ability to be a full citizen, not dependent on the others, not obliged to go certain ways and not other certain ways, to have full access to the city, but it's also a very, very educative for drivers and for people who could see these little humans biking, and then they are more aware of the speed. They're more aware of the fact that, sooner or later I'll have this little kid crossing. And when they stop, I should stop. And when they run, I should stop. And when they pass, I should stop. The driver should. And so it's twofold. It, first of all, teaches the future citizens, the future adult citizens of the city to own the city and to have these rights and to enforce them onto the others. But it also teaches those who've abused their rights so far through vehicles and through public-private transportation to settle down and to acknowledge that this is not a birthright. Having a car does not make you exceptional, does not make you special, does not make you more worthy of the city than one that doesn't own a car. Other things that we're doing in Tirana that might be of interest for other cities are also expanding on these playgrounds. And when I'm talking about playgrounds, I'm not necessarily talking about just places where where kids can play, but we're also talking about community space. These were safe havens for us during COVID, just because they were the only spaces available for people who would otherwise be living in apartments, in crowded apartments, to have an interaction that was safe. So more than just providing a space for kids, a safe space for kids to play, they work for building communities, for getting neighbors to know each other. Some people had been living together in like decades and they had never had struck conversation, just because there was no place close to their home to be able to do that and to have that opportunity. The other thing that they do is that they provide major security, because if you know who's living close to you, then if a danger is coming, or if somebody is going around that is not part of that community. So you basically watch for things that are suspicious, but you also are a very good preserver of what is public. So, these playgrounds that we build in the neighborhoods, they get extra gardening from, they get extra guards from the community. They get extra care by the people who live there, because they're the ones who use them the most. And we have a deal with all the neighborhoods, so all smaller communities, and I would say, if you make space, so, remove your car from the place you've parked for like 30 years and find another spot close by, or, get your fence or gate to be a little bit closer to your house and, leave some space. If you can find that space, then we will build a playground. And that deal has gotten us from 0 playgrounds in the city to, last count now was 82, if I'm not mistaken. And for a city of 1 million, it's still not enough, but it's way better than what it was when we first got into this office. It was 0, that famous number. Other things that you do to basically manage mobility, and especially for young people, and especially for those who do not have the means of other alternatives, we have initiated this, and this is also in collaboration with GIZ, this initiative of schools, of Streets for Kids, that I wanted to also share. Streets for Kids, the basic objective is to make a safe space around the school building for kids who are commuting or living close by. What that means is that basically in the block surrounding that particular building, you close access for cars for the whole time or for most of the possible time, so that when kids go in and out, they can actually walk safely in and out of the school. But most importantly, what we found out was that traffic is mostly created by parents who are driving their kids. And in some cases, there are parents who are driving their kids from very, very close buildings. So they're very close to the buildings, but the reason why they're driving is because they don't feel safe for their kids to walk to school. Now, what do you do to make kids feel safe to walk to school? Well, we actually close all space for cars. And so parents don't have to actually drive them or take them anywhere, because we've already created that outer barrier where no cars are allowed to enter. And so that is, those are a few of the initiatives. I don't want to take more time from the speakers, but would be really happy, and I have Esmeralda, one of my colleagues here, to take questions and be sharing some of that experience with you. Thank you very much. And Mangesh, it's your turn.
Thanks, Anwar. Mangesh, please.
Yes. I'll share my presentation. Just give me a minute.
Mangesh, you made it home from the traffic.
Yeah, I made it home. Just a minute.
And while Mangesh's presentation is loading, I just want to say, Anuela, it's amazing to hear all the initiatives that Tirana has been taking on. So I think that we'll have some really interesting questions, and it's just amazing to hear all the holistic approach that you're taking. And like you said, it's a basic right. It's a basic human right to have access. It's such a strong and a powerful statement.
Mangesh, would you like me to present your slides, by the way? Would that be helpful? Hello.
There.
Yeah. Can you see the screen?
Yes, we can.
Yes. Is this?
Mangesh, we can see your screen, but we're having trouble hearing you. Okay.
Okay. Yeah, you can.
Maybe it would be better.
You can see the slides now?
We can see the slides, but we can't hear you very well. It might be too much bandwidth. So maybe Ivona can present your slides.
You can't hear me? Yeah.
We can hear you now.
Am I audible now? Am I audible now?
Yes, you are.
Okay. Yeah. Thank you. Thank you very much. I'll briefly go through Washington. And this is my city, Pune city, having a population of around 3.5 million, 500 square kilometer area, and around 16.9 billion USD as GDP. Well, with Urban 95, the kind of structure we have in municipal corporation is we have a steering committee, which is headed by our administrative head, that is the additional municipal commissioner. And there are different departments who are a part of this committee. There's a technical committee, expert committee who supports the different departments, and we also have a project management unit. With Urban 95, we did 6 pilot projects, and the second phase has started recently, and there are 15. You can see here the kind of pilot interventions, the projects that we did in Pune city. Here is one example of a garden where a small cost was made at a maternity hospital where a place which was a very boring place. It was modified, painted, and some street furniture were kept so that waiting for the hospital became more interesting. We have this Ambedkar Vasti at Aund. Basically, it's an Anganwadi for small children, was being occupied by other people. And here we started some activities like painting and play area for children. And soon we saw that the children captured that area very well, and it started being used exactly for the purpose it was made for. This is one of the crossings that we have on a street, a busy street, where we did a lot of survey about the neighborhood concept that we are talking about, and the residential area on the other side of the street. Got connected with this kind of, with help of the police department. The road crossing became very child friendly, even for the caregiver. Some of the garden with the concept of how do we put up sensory elements like audio, like visual, like glass reflection, some painting, and this place which was usually being too much crowded with adults started becoming very children crowded. For the parkings and for the vehicles, it got transformed into waiting areas for the caregivers. Basically, with these pilot project, the key learnings which we have from understand the concepts of Urban 95, the street garden interventions brought out new ideas how some of small modifications the gardens could be very, very attractive to children. It's not only garden, it's the road department, it is a development plan, it is a budget
Mangesh,
department. All these department stakeholders have to come together.
Hello, Mangesh. Do you mind if I take over screen sharing, and maybe that'll help with the bandwidth? Do you hear me?
Okay. Yes. I'll stop sharing my screen.
Okay, 1 second. I will just restart from where you stopped, and then let's see if that's going to help. Can everyone see the screen?
Yes.
Okay, go ahead,
yes.
Mangesh.
Okay, yeah. So here media coverage played a very, very important role to bring to people and to the citizens to make them understand what are the children. Well, taking up some projects, collecting data, and after the project is completing and again collecting data and analyzing, it helps a lot for us to understand how the change took place. So data-driven design and data-driven approach is very, very important. And of course, with data comes the documentation, because documentation is something where it is shared for the upcoming projects, and also it can be shared inter-cross departments so that the design department understands what the execution department is doing. So yeah, we can put the next screen. Here is an example of Godse Chowk, which we have started up doing in the second phase. And this is again making the junction very safe for children to cross. These are the different ideas that we took apart from the regular zebra crossing that we do. Next slide. Yeah, next slide. Okay, this is one photograph of a particular garden. This we took up in the second phase, and we have all the Urban 95 elements in the drawings as well as they've come up in the garden. This particular slide which you see here is a children traffic park, a niche area out of near a junction near the road was taken up, which was unused area, and that is converted into children traffic park. You can see in the 2-3 slides, next slides, where all these small elements for the children are put up with respect to understand the traffic rules. So we have got the scaled down models of all the signages and all the different traffic signals, even they are scaled down, where small children can come and understand the traffic rules so that they become better, a safer citizen when they grow up. Next slide. You can see some more pictures of this traffic park. This has really helped a lot of school children to understand these traffic rules. And here, it's not only the corporation, but even the traffic police have their personnel who comes and gives training. We also have citizens engagement in terms of non-government organization taking a step forward to arrange school visits here. Next slide. Yeah, next slide. Yeah, some more. So make interesting. How does the driving license look? And this particular slide is talking about the urban street design guideline, which the municipal corporation has prepared. And within these urban street guidelines, the element of Urban 95 was not there. But when we started with Urban 95 program, now we are modifying these street guidelines so that these Urban 95 elements can be incorporated into streets. The street guidelines here, they talk about the idea is to widen the footpath. And here is one photograph you can see just across the shop, which is the frontage area of the shop, has been merged with the footpath. So we have got wider footpath without compromising the road widths here. And the photograph on the right bottom corner, you can see a junction and a very safe pedestrian crossing with the help of bollards. Such type of footpath transformation is taking place at different locations where we are doing the urban street retrofit design program, and more than 65 kilometers of the street have been transformed. And slowly, the Urban 95 concept is now seeping onto the drawing boards of the architects who are designing the streets. And this is a in-house facility of the municipal corporation. That's how we are doing the capacity building for the municipal staff and the designers. Next slide. Yeah, we can move on to the next slide. Yeah, this particular slide, I would have to emphasize that as we bring in new ideas about the street retrofit program, the slide which we saw earlier, the budgetary allocation is important. So for the past 4 years, the budget which was very low for the urban infrastructure, where the non-motorized transport and the cycling, which is given more important for the urban street, that budget has been increasing every year. And this year we have more and more budget for streets which are child friendly, which are pedestrian friendly, and which are friendly for the cyclists. But along with that, we also are working a lot on the different air pollution program, where at the federal level we have the National Clean Air Program, and under which we are taking up different projects to improve the city's air quality. Thank you very much.
Great, thanks, Mangesh. That was great. I know we had a few technical difficulties, but I'm really impressed always by the way you approach this design and how Urban 95 lens was kind of integrated in all aspects of it. I want to quickly call on Santiago, and then maybe we'll spend maybe 10 minutes in the end for Q&As. So Santiago, if you could go ahead, and then for others, if you want to put in more questions, that would be great. I already see a few questions in the Q&A chat, but if there are others, please send your questions this way.
Hi, everybody. Just checking if everybody can see my screen. Awesome. Then we don't have much time, so I'm just going to take off. Good to meet everybody today. As I was presented earlier, I'm Santiago Fernandez. I'm from the Office of ITDP Mexico. I work as a research manager over there. So just to maybe talk about this a little bit, why should we measure accessibility? I think Ivona and all the other presenters gave a really good explanation of why it's important to switch to an accessibility-based framework. At the very least, it allows us to align different policy goals that were traditionally thought about in distinct ways. No, for example, transport planners were thinking about transport policy. Spatial planners were thinking about where to locate things, and people working on social policy were developing policies for social inclusion. But there wasn't really a framework for all of them to work together, and accessibility could do that. The question for me is more about like what happens when we don't think about accessibility and we plan without thinking about it. And Mexico City is a very good example of that. You're looking at how Mexican cities are growing, and this perhaps is similar to what is happening in other cities in the world. We're growing in very disconnected neighborhoods and very peripheral areas, and what we have found is that this really affects the accessibility that people have when they move to these places. And that's why in many of these places, they have very large rates of abandonment. So what are cities doing to change this? There are some cities that are setting accessibility goals, most famously and recently Paris, which the Paris of 15 minutes, which made international news. But cities had been thinking about this before. Sydney, Singapore had already released their land and transport plans that were already inserting some accessibility goals. For example, allowing 90% of people to be within 20 minutes of key services and employment locations. But how do we translate these goals into actionable policies, and how to keep track of the progress when we're working on this, and how do we align incentives? I think that's key. And one of the answers is we need indicators. We need to measure where we are, and we need to measure where we're going. So accessibility indicators, there are many. There are many ways to measure access. One way to measure it is through cumulative opportunity indicators. They're very simple to understand. I have an example here on the screen. And it's basically through an isochrone, you map the area that you can reach traveling within a given travel time, and you just count the different opportunities that are within it. So that gives us a very basic indicator that, although it's limited, it allows us to understand in one simple measure what not only if we can reach things, but also what are the conditions in which you can reach them. So these indicators can be aggregated and worked with in many different ways. And that's why I'm going to show you today some ways in which we can calculate them easily, and we can visualize them for policy purposes, or also just to show them to non-experts. How to measure them? Luckily, right now, there's increasingly availability of data. I'm sorry. There's many open data and open source software tools that are available for policymakers and academics and anybody interested in calculating these types of indicators. We have transit system data from the GTFS. I don't know if people are familiar with this concept. GTFS is basically the data that different transport planners, transport planning apps use, such as Google Maps. When you ask for a route, it uses GTFS to show you what's the best itinerary for you. But there's also street network data thanks to OpenStreetMap, which is open and easily accessible. Now we have traffic data thanks to, for example, Waze, the Connected Citizens program, which opens this kinds of data for cities. Now we have more and more spatial data with high resolution, and these are also open without a cost in many cases. There's open source software tools such as Python, R, and all other more specialized ones like OpenStreetPlanner. We can talk about more in detail later, and you can also reach me if you're interested in any of these tools. But just to show you that now there's a very interesting ecosystem of tools that are accessible to more specifically cities in the global south, where traditionally data had been more scarce. So what are the applications for these kinds of tools and measurements? For example, planners have been testing these tools to evaluate impacts. This is an example in the city of Rio, when some researchers tested what was the impact of the new BRT lines that were implemented during the 2016 Olympic Games. And they found that contrary to their initial expectations, the service changes due to the BRT actually affected accessibility in some of the poorer areas of the city. So now we have an indicator where we can measure this, and we can identify where are the communities that are getting benefited the most or affected the most in terms of accessibility, in terms of how they can access the things they need. Other cities have been using it, for example, to communicate service changes in the public transport network. This is an example in Dublin where the government shared these visualization tools for the public when they were deciding whether to enact a new service plan. And this allowed people to check if where they live and where they were going, they would have better or worse accessibility with a new plan. So this is a way to open up like what's traditionally a black box in which transportation engineers don't really are not communicating effectively to non-experts and the public what are the actual impacts of the systems on their lives. So this is useful, and we haven't seen many examples of this in cities in the global south though. More recently, an interesting application is to develop accessibility standards for social housing. This is a recent case that we experienced in Mexico. The image I showed earlier was one of these developments where close to 70% of the housing is abandoned mostly due to poor accessibility. So we've been working with them through the last year to develop basic indicators in which they can embed into their lending rules. So right now, the new rules will come into effect in May 2022. And to be eligible for credit, a social house would need to be at least 30 minutes walking, considering the transport network, from a school, a clinic, a grocery store, a recreation center, and an employment center. This is a big change, and we hope that this will have an impact on a large scale. Sorry, that's the other way. And to show you how does this tool look like, I'm going to show you some of the tools that ITDP has worked with recently. This is one of our first examples. We developed this in our office using only open data source and open software tools. This is how it looks. It's not really pretty, and it was done in 2017. And what you see in green is an isochrone from our office that shows the number of jobs that we can reach. We also have a very interesting precedent with our office in Brazil that worked with IPEI over there to develop this visualization platform, which you can visit. And it shows accessibility levels in many Brazilian cities. And it's multimodal, and it's very interesting just to go through them and evaluate your city. How does it look like the area where you live? Just to jump through what we're working on right now. Right now in our office, we're working on a new visualization tool, also using mostly open source tools and data for the 20 largest Mexican cities. This we're hoping to launch this in a couple of months, but this is how it's starting to look. We have a multimodal platform. We can evaluate access by walking, cycling, transit, and car under different time thresholds. And it also has other tools that we are working with. For example, it looks like this. What we're looking at right now is the number of employment accessibility, the level of employment accessibility in the Mexico City metropolitan area. And just to go quickly through some of the functionalities. For example, this is the area that you can reach traveling by bike 30 minutes. And the user can just pick a hexagon and you evaluate the accessibility conditions there. We can also test now some scenarios, so different conditions to compare between modes or between different infrastructure scenarios of the same mode. For example, if we propose a new line.
Santiago, I'm going to ask you to start wrapping up just because I want to make sure we get time for some of the audience questions here.
Absolutely. Sorry.
I think these tools are great, and it would be great if you can share the link in the chat, and I'm sure there'll be more questions and people can connect. But I want to make sure we have time for at least one or two questions.
Absolutely. This is the last slide, so you can go ahead.
Great, thank you so much. I think it's really amazing to see what data can do, and I think you really, Santiago pointed out that you need the baseline before you can start the thinking of 15-minute neighborhood. Which brings me to the first question, which I see in the chat is there is a lot of question around how do you define 15 minutes? What's the walkability? How is it different for different age groups? So my question to all of you actually in the panel is that as you're thinking, 15 minutes neighborhood is great as a concept. But also, like, what does it really mean? And I think, Ivana, if you can kind of start with giving us an insight on what that means. I think Gemma had some really interesting idea on connectivity. And Wella, you touched on this too, on how to bring communities together. So what's the community side of it? And Mangesh, from your side, as you're thinking of like using that Urban 95 lens, how does that translate into what it becomes on the ground? So maybe if each of you can comment on the idea itself of 15-minute neighborhood, that would be great. And then I have one more question, Anuela, for you that I'm going to ask. That's in the chat too. So Ivana, if you can start, Anuela, and then Mangesh and Santiago.
Sure. Thanks so much, Ankita. So there has been a pondering question, like what is the difference between 15 and 20-minute neighborhoods? Like what does that mean to cities of different sizes? What does that mean to people of different mobility constraints? So in general, this concept is really about, enabling access through walking, cycling, and public transport. And this really translates to the concept of transit-oriented development, where neighborhoods are anchored around sustainable transport options. So for example, cities that are maybe larger and historically they have a more defined mesh of streets and open spaces, it's more easy for them to apply this concept of 15-minute neighborhoods. But we see that cities that are sprawled, maybe they have been trying out the concept from 20-minute standpoint. So whichever it is, we have to remember that access has to be provided to public transportation, and there have to be good walking conditions. For example, one of the cities that has been pioneering this concept is city of Melbourne, but it took them about 3 decades to really retrofit its fabric to the walkable and accessible city. So it's not like something that can happen overnight.
From the Tirana's perspective, the 15 minutes is a little bit of, you have to set the standard somewhere or like the limit somewhere. But what it really means is that can you walk or bike to everything you'd otherwise need for a fully functional life in the city where you live? So no matter where you're living, even if that's a periphery or if that's the center of, could you have access? So if you wish to not ever take a car ever in your life, could you have access to everything you basically need from morning till night, from birth till whatever, within this reachability? And that's basically the measure of it. And so it could be 5 minutes, it could be 3 minutes, but it could also be 20 minutes. So there's not, a magic number there. The 15 minutes is the most acceptable comprehensive kind of concept that we're talking here, but it's not necessarily a question of time. It's a question of safety first, and opportunity to have mixed use of urban development. Because, if you're talking about, fully residential and fully business and fully financial and fully IT and fully industrial, then you're not talking about cities. This is not a city. This is not the concept we're talking about. We're talking about, could you have or could you build in the urban sense spaces where all of the functions of one person's normal life could intertwine with each other, respecting one another, and be able to have a quality of life for all, independently from where and independently from who you are. So basically that's, kind of like the definition of how we're measuring it. Tirana used to be a city where there was no private transportation whatsoever during communism. We're not allowed to have any private vehicles. So wanting or not wanting to do it, we had to have a health center that was, for this particular neighborhood, and a pharmacy that was, and that was, those were horrible times, but that was the concept of how the city was built back then. Now, in this 30 years, because people started to build for their own personal functions, not for the community and combining those things. So it tended to do what the West or what the world had been doing for so many years. That concept was lost in these new neighborhoods. And that's what we're trying to recuperate right now. After the earthquake, we had a great opportunity to rebuild entire new neighborhoods. Instead of just rebuilding isolated buildings that were crumbling, we decided, you know, whatever, we're just conceiving new neighborhoods now. And those neighborhoods have space for institutions, space for businesses, common areas that they could be used by the people who work during the day and by the residents after the working hours. And even if you think of it in the economy of land, you know, how you're best using space that is so scarce in our world today, that the math is there, you know, there's no other way to go. Because if somebody has to have a park for their lunch break, they'll have to have a park after working and, you know, we're in a stroll with their kids. Why not have the same park being used for both daytime and afternoon and evening time while we mingle all this mixed use? So that's basically the concept of it.
Thanks, Anuela. And I think you kind of touched a little bit on the other question that is also in the chat, which is like using the strategies and policies to redevelop neighborhoods. And I think it's from an anonymous attendee, but I think what's really interesting is Tirana did look into also kind of looking at the development and developers and like looking at tax incentives. So I think that's really interesting as you're thinking of redevelopment, also bringing that insight into the way you want to plan your city for future. But I want to pass it on to Mangesh and Santiago, and then we'll do like one round of quick rapid fire question to wrap it up. So Mangesh, and your point of view on what 15-minute concept really means in case of Pune, and then I'll pass it on to Santiago.
Yeah, I have 2 points here. One is now that we are working on the retrofitting of the Pune streets. So the whole idea is to reallocate the streetscape or the street area to promote the non-motorized and the pedestrians. So here it's giving access to these people in a very a mobility-friendly way. It's not only just redesigning the streets, but also now that we are integrating the metro shared type of vehicles. Now that electric vehicles are on rise, we'll be putting up some of these shared mobility small scale electric vehicles, which will be put up on a pay as you use basis. So again, so that we have the first and the last mile connectivity at the public transport 15-minute concept into mobility.
Thanks, Mangesh, for that. The 15-minute concept as a last mile connectivity. That's really interesting. I think there's a comment from Mike King on time versus the distance and how interesting the concept of 15 minutes itself is. Santiago, any thoughts from you on what this means as you look at tools that allow us to access and look at that baseline?
Absolutely. My answer, I really resonated with what Anuela was saying. I think that we shouldn't linger too much on the 15-minute number or that threshold. In the end, we choose that number because it's convenient, because it's very easy to understand, but it does have a basis. I mean, there's some research that shows that people usually like to travel 1 hour per day, more or less, and that's like a constant that we can see through different cultures and different nations and different areas. So 15 minutes is just a translation of that. It sort of translates to like, let's say 4 trips per day, 2 trips back and forth to a key destination. So that sort of makes it tangible, for people and non-experts. So I think that 15-minute neighborhoods really put the finger on walkability, which is the basic of mobility, the basis of our mobility, and the only transport mode that's truly accessible to all. So that's why I think this concept makes sense, but we shouldn't think about too much about 16, why not 17,
Perfect. And I think that's a really nice way to summarize the concept itself. And as last thoughts, as we wrap up, I'd invite all of you to think of one action or one quick win that that you would suggest the audience that they can take as the first step towards designing this access for all and thinking of access for all. So it could be something as, Anuela, you said, in Tirana, like, don't make car the king and have like, bike lanes and little kids as the way forward. So one action that the audience can think of as that first step towards creating 15 minutes neighborhood, or in this case, as we discussed, this idea of access for all. So maybe we'll start with we'll start with Anuela, Mangesh, and then Santiago, and Ivana, I'll give you the last word.
One point of action. It's impossible to have one point, and I do want to say one action, but I want to say if we have the thinking of all citizens have equal rights, then we're having the right thinking in development, and that is in streets, in buildings, in energy efficiency, in any other action that we think of. If we invest the same in an equal and equitable way, then we're on the right way to the 15-minute city.
Great, thanks, Anuela. Mangesh.
Yeah, just one action. Well, to put it in one sentence, I would say, let us build cities for people and not for cars. So I think if we redesign our streets, we'll have
Perfect. So
accessibility.
Streets, cities for people, not for cars. Santiago.
Actually, Mangesh stole my reply. I was going to say sidewalks. But maybe to talk about a little bit of the things that I was talking about earlier, we need to push our governments to develop some basic data sources such as UTFS. Somebody was talking in the chat that these data sources are not available everywhere. So just to let everyone know, these are data that's very easily built, that's very easily shared. It's open standards. So that could be a key element in developing the indicators we need to push this forward.
Data to define decisions and guide decisions. Ivana, one action.
Sure, I will mention building off of community strengths and community identity, because I think this is where community needs lie, including babies and toddlers. So really elevating those and building off of, cultural traits, heritage, and sort of like the NIMBY cultural and social weavings within the community.
Great, thank you so much. That is amazing. So from making sure that we're lowering the bar and access for all, as Anuela mentioned, to designing streets for people, not cars, data as a way, and of course, community, the 4 points that I think all of you also touched on in your presentations and as you were talking about the work that you've been doing. So I want to thank everyone, and I want to thank ITDP for putting this panel together, but also bringing us the Access for All paper. I'll stop here. I don't know if you or May want to say anything else. And if not, I also want to thank everyone else who joined and stayed with us slightly over time. This was great. Thank you so much.
I just want to jump in and say this was an amazing discussion. I really appreciate everyone's contribution. I loved it. I loved it so much. And I just wanted to come back to where we started, which was we asked who was a caregiver, and 76% of the audience said that they weren't. And I kind of find that shocking, because I think that also comes back to how do you define what a caregiver is? And you're taking care. I think we're all caregivers. So I just wanted to throw that out as one last plug. I know it's different for babies and toddlers and early childhood development, but I think really integrating the care aspects of our lives more fully is really important and a key component of this idea of a 15-minute neighborhood. It's about human rights and human access and development and community. It's wonderful. So anyway, thanks everyone. And Ivana, I'll kick it to you.
Great. So I'll actually ask Pam to close us off with the session and few housekeeping announcements.
Thank you so much to today's moderators, panelists, as well as our attendees for joining this event. I wanted to invite you to a post-webinar survey that will appear automatically on your screens when we end the session. This will help us with the next steps around today's topic. I also encourage you to visit ITDP's website and social media to be up to date with the latest releases and upcoming events. We will host part 2 of the series on access focusing on public transport in April, so stay tuned for the announcement.